Well, hello everyone. This is the beginning of A&P, and Anatomy and Physiology is a really interesting course in the sense that it really discusses our origins as people and breaking down who we are. One of the big mistakes we often make as people is we don't actually understand ourselves that much. And we go around with more of a superficial understanding of our bodies and just operate them. So, the goal with this course and any course is to make sure that you understand what it means to be you. We have to start that out on a very basic level. And so, we're going to go through some of the slides here that make up this first foray into the major themes of anatomy and physiology. And really, what are we doing? We're looking at inspection, we're palpitating, we're looking at percussion, dissection. There's different ways to discuss the structure of the human body. Then we're also looking at gross anatomy. We're looking at histology, looking at tissues. We're looking at microscopic examination of tissues through histopathology and cytology, structure and function of cells, fine detail, the ultrastructure, microscopic level here for this. And then we look at physiology, which uses methods of experimental science. So we look at neurophysiology, endocrinology, and pathophysiology. So we're looking at the nervous system, hormones, and mechanisms of disease for that. Then we also look at comparative physiology, which is the study of different species to learn about body functions. I was first introduced to physiology, especially when I was in college, and I had a really nice segue into it because I was a collegiate track and field athlete, and I was able to better understand how things work together because I was an athlete. So I was able to take the things I was learning in the classroom and apply them to my track and field career, if you would, for 4 years for that. Now, you may not be athletes, but I will say this: exercise is an incredible pathway to knowing your body. I actually think it's the best way to know your body, to understand how to best optimize our anatomy and physiology. Now, a lot of what happens in content for courses is based off of what is the pathological dysfunction or chronic disease related to anatomy and physiology. But I don't think you can talk about that without talking about what optimizes the system as well. And there's no better component for that than exercise for that. So I will basically giving you kind of an exercise slant to this. It's my background, it's my profession as an exercise professional, and it's very complementary when talking about anatomy. Speaking of the principle of complementarity, which anatomy and physiology are really inseparable, which is also often the same case to me with exercise and anatomy and physiology. It's inseparable because it explains the system so well. Another example of this is bones support and protect the body due to mineral deposits and blood flow to one direction through the heart and the lungs. The site of gas exchange occurs with that. And then we have all the different organ systems that are coming together, microscopic cells, tissues, everything works together in a beautiful design to make you. And so you are very interesting. So we're going to go down that hole here. So that hierarchical structure is really important. We have organisms composed of organ systems that have organs. Organs are composed of tissues. Tissues are composed of cells, then to organelles, molecules, atoms on the deepest level here. So this hierarchical structure is really important. So when we look at an organism as one single complete individual. The organ system is a group of organs that have unique and collective function to help function the entire body. Everything from respiration, circulation, digestion, immunity, muscular contraction, and so on and so forth. And then we have organs, which structure composed of two or more tissue types that work together to carry out a function. An organ has defined anatomical boundaries and can have organs within organs as well. So, as we go along, one thing that's really important to understand, and I think, again, this is best understood through exercise, is that everyone has different anatomical variation. Yes, we all have a spleen, a gallbladder, and heart, and lungs, and all these things are very similar. But no two humans are exactly alike. Even identical twins have some level of difference there. And there's genetic components to this. There's some individualization within vertebrae and muscularity, type 1, type 2 muscle fiber types, the amount of that there. We have some different, organ placement for people, some atypical number of organs. There's just lots of bio variability within people. And this explains a lot about human performance, certainly athletic performance as well. But even though we have standards and guidelines, everyone's anatomical variation means they move differently and function somewhat differently in the world. So that's a really major thing to think about there. So there's even more physiological variation. So you can think about this when looking at physiological variation in sex or gender, person's age, what's their nutrition, their weight, physical activity, height, genetics, the environment, the role they play in that. Obviously, how physiological function is going to be very different and manifest differently in someone who's, say, like 6'8", 250 versus someone who's like me, who's 5'5", 132 pounds. Very different, or between genders as well there. So we cannot look at people always the same way. Failure to consider this variation can lead to things such as over-medication, or medicating people differently, or prescribing exercise regimens and things like that to people that do not adjust for individual variation for that, okay? So, as we go along, we also understand that life is a collection of properties that distinguish living from non living things. So, the organization, living things exhibit a higher level of organization, obviously, than non living things, right? We have cellular composition, metabolism, which is the sum of internal chemical change. Interesting aspect about metabolism. For a very long time, we thought that metabolism, which essentially just is a process of ingesting uh, nutrients and then what we do with those nutrients at our body and then excreting those things. The process for that, we often thought we hit this magical age of 40 and our metabolism slows down. That is a myth. And actually, what we know is that metabolism stays pretty consistent and similar from 20 all the way through 60. After that, we start experiencing a much larger change in our metabolic rate. Now, this was done by a really large, incredible study, I believe through Duke University, that came out a few years ago, which confirmed and indicated this information here. So, just some interesting information. If someone tells you their metabolism is slowing down and they're 35, 40, unless there's some pathological condition going on, that is not true. We also have responsiveness, where it's your ability to sense and react to changes or stimuli in the environment, and movement, which really is just a change in position of your body. One big thing that we need to understand when looking at anatomy and physiology is homeostasis. Your body is essentially a machine that is trying to stay within a balanced situation. It's in essentially a set point. It doesn't want to have too much variation one way or another. And what's actually super amazing about the human body is there are all these mechanisms in there that pull you in one direction or the other, or pull you back towards the middle, one way or the other, when things go haywire. So, for example, you have insulin and glucagon, right? These things are opposites, but they help pull you when one is too far over, the other one brings you back there. So this differentiation is really important. So it's basically maintaining relatively stable conditions internally in your body. Your body wants a stable internal environment. It doesn't want a chaotic internal environment. You actually may know this when you eat something that doesn't agree with you, that your body feels like your stomach is in chaos with that, right? Your body's always trying to figure out a way to get you back to homeostasis, that relatively stable internal environment. That is a big characteristic of life. We look at things like blood pressure. We look at things like feedback loops, such as when you're hot and cold, your body is trying to get you back to where you need to be. Other characteristics of life, reproduction. Organisms reproduce essentially copies of themselves and pass off those genes to offspring. And then also we look at evolution. Genetic change from generation to generation occurs to mutations or changes in DNA structure there for that. So when we look at homeostasis, again, we're looking at kind of negative feedback loops here. So ability to detect change, activate mechanisms that oppose it, and thereby maintain relatively stable conditions for that, right? So we're going to talk a little bit about feedback loops coming up here, specific ones. And what happens is when we don't have homeostasis, we have essentially what is called a runaway train effect. When we lose control of homeostasis, it usually leads to profound illness or death. So your body, as you're walking around, remember, think about you. You're learning about you as you're moving around in your life. There are a tremendous amount of things that are happening inside your body to keep you together, to have stability. Stability is incredibly important, not only in internal systems, but also in external systems as well for that. So, our negative feedback and homeostasis is really important. So, this negative feedback is a mechanism that keeps a variable close to set point. The body senses a change and it reverses it. So, a body senses a change and reverses it. So, because feedback mechanisms alter the original changes that trigger them, they are called feedback loops. So, let's talk about one that I think will be really interesting for you guys and have a lot of relatability. So, let's talk about body temperature. Okay, so what happens when you feel like you're too cold? What happens? What do you think happens here? Well, what happens when you get really, really cold? Okay, what happens? You start to shiver, right? This shivering happens, your body starts shaking to try to get you to get warmer. Think about it. If you're cold, one of the best ways to get warm is to get up and move around, walk, increase your body temperature. When you're too warm, what happens? You start sweating, right? The sweat is to help you to cool your body down. Fun fact, when you exercise regularly, you actually start sweating much sooner. What's happening here with that? So, when you don't exercise regularly, you often will see someone who, when they do some activity, they'll get very red in the face, very red in the face in the absence of sweating. Sweating very quickly during a workout indicates your thermoregulatory system is working at a high level, meaning it's getting rid of heat out of your system as quickly as possible. Just like your thermostat. Think about your thermostat. When does your thermostat kick on? When it goes below a certain temperature, the thermostat kicks on to heat your home, right? When it goes above that temperature, all that's working, it's working, and it's too warm, it shuts off. Your body essentially works that way, like a thermostat. And when it looks at being hot and cold, you can make that parallel association that your body, your thermoregulatory system, works almost exactly like heating and cold in your home. It's a great way to remember it there and serves as a feedback loop, right? So think about that as like, to me, is almost the most famous feedback loop as well. You also have a feedback loop of homeostasis of blood pressure, right? So you have a rise. When you rise from the bed, blood drains from your head and blood pressure falls in that region. So baroreceptors, these are detected by baroreceptors that transmit signals to the cardiac center, the brainstem. The cardiac center then transmits the signal to the heart to increase your heart rate, raising your blood pressure. Again, restoring homeostasis. This one is not always so relatable to a lot of people as much as the thermostat one because we have a mechanical equivalent here that shows you that. But again, this is happening all over your body, literally everywhere inside your system, this push and pull to get your body back to a relatively stable internal environment. So then there's also a positive feedback or rapid change loop that happens here. This leads to greater change in the same direction as opposed to a corrective action of feedback that happens with the negative loop here. So the positive loop feedback goes in the same direction, greater intensity, where the negative loop is pulling you back to try to pull you into homeostasis. So again, this is a normal way of producing rapid changes. So examples of this to move something towards a different destination would be childbirth, blood clotting, protein digestion, and generation of nerve signals. I think the childbirth part is one that's pretty universal for a lot of people. As a woman's about to have a child, there's a positive feedback loop to help that child become delivered at that point. So again, childbirth, a great example of that. Any disturbance of homeostasis often increases the risk of disease, contributes to changes associated with aging, and may allow a destructive feedback mechanism to take over. So without proper homeostatic mechanisms, you may again have this runaway train effect. There's no brakes on the car anymore. You're just moving in a certain direction. Something like also having a fever is a good thing, right? Pain and fever are feedback mechanisms, but if they don't get corrected, they become runaway trains that could lead to death and great disease. So important to understand that as well there. All right. So, you're going to be learning about all these different organ systems of the body, from the integumentary system related to skin and structures. With that, skeletal systems, we're looking at bones and joints, or muscular system, the nervous system, endocrine system, cardiovascular system, lymphatic system, respiratory system, all these different digestive systems, urinary system, and your reproductive system. All these systems are major systems of the body. Again, also that operate in a very homeostatic mechanism as well for that. All right, so we're moving on now here. So let's think about the term, just we're going to start getting the terminology. Terminology is actually one of my favorite things to know about anatomy because it's baseline level, it's language. Language builds civilizations and builds understandings. When we don't have a good understanding of language and operational definitions, we often make really poor decisions or don't understand topics. This happens quite a bit in our society today where we don't take the time to understand. We just look at things very surface level and then don't get actually what is happening, and regardless of the topic. But anatomy is important. Again, you're walking around every day being yourself without knowing yourself. Having this course gives you knowledge. Knowledge gives you power. That power gives you the ability to make better decisions with what you're doing with your body, how you understand your body, and will give you more respect for your body as well. So, anatomical position is essentially just a standard anatomical body position where your body is straight up or erect, feet slightly apart, palms out. All right. Body's erect, feet apart, palms facing forward. That's anatomical position. Okay. Now, as we're looking at directional terminology, I want you to look at this. Think about directional terminology and chunking it into twos. Directional terminology, so there's one, and then there's one direction, and then there's the other. Okay, this also is very much a homeostatic mechanism when we look at it. These two things, one is going one direction, and going goes the other. So when we look at superior, think top of the head. Think if something is superior, it's above. Inferior, something is below, away from the head. Okay. So we think about anterior, towards the front, posterior, towards the back. Again, try not to memorize these or think about these all in one big sheet of terminology. Chunk them together. We do better in learning things when we chunk them together. So again, remember, superior above, inferior below. Keep those together. Anterior to the front, posterior to the back. All right. As we look at medial, medial means closer towards the midline, towards the middle of my body, lateral away from the body, and intermediate is between medial and lateral there, okay? Now, we look at, especially when we look at origin insertion, we're looking at proximal and distal. Proximal, remember, approximate, closest to. Distal, distance away. Again, proximal, approximation, closest to. Distal, distance, further away from the origin there. All right, other directional terms we have is ipsilateral, contralateral. Ipsilateral means on the same side of the body. Ipsilateral. Contralateral is the opposite side. Again, used often in exercise terminology with resistance training, especially. Ipsilateral, same side. Contralateral, op side. Contrast, think contralateral contrast there. All right. Then you also have superficial and deep. Seems pretty simple, right? Superficial, towards the surface. Something superficial, it's very surface level. Deep, underneath, towards the body, towards the core of the body. Something's deep. Think about it's deep. It has a lot of substance to it. And then we also look at visceral and parietal. Visceral, look at pertaining into covering an organ, right? So we talk about visceral fat. You'll talk about the fat covering an organ. Or parietal, pertaining to the covering against a cavity wall. One is covering the organ, and one is against the cavity wall there as well. And then we have some regional terms such as axial and appendicular. Appendicular, think about appendages, like your phalanges, your fingers, your arms, okay, your limbs. Axial, this is all more closer to the center of the body. Think about your head, neck, your trunk, all right? But always think about appendicular appendages with that as well. Other regional names like cranial, referring to head or skull, cervical, neck, cubital, elbow, carpal, wrist, patellar for the knee, orbital, eye, okay, thoracic, Think about chest or the thoracic spine, inguinal groin. Okay, inguinal groin here. We also have other names like metacarpal hand, plantar, sole, buccal, cheek, axillary armpit, femoral bone, thigh, glutes, gluteal, butt, tarsal for ankle, and digital toes, fingers, so on and so forth. Okay? So there's a lot more terminology with this. Continue to go through this and look at it. The last thing we're going to focus on here really is on the body, the planes of motion. Again, this is where exercise becomes a really big deal for this as well. And you'll get that. But we look at the planes of motion. These are imaginary flat surfaces that separate the body or body part into portions. So we have sagittal, transverse, and frontal. Okay. When we look at sagittal, this divides the body into right and left halves. Sagittal divides the body into right, left halves, or one mid-sagittal plane, okay? So there are an infinite number of parasagittal planes, but when we look at sagittal planes, okay, and right and left, the movement in here is flexion and extension. So think about if you've ever been to the gym and you did knee extension machine. All right. So all you're doing is you're flexing your knee and then you're extending it. That plane of motion is flexion, extension, flexion, extension. All right. Happening in the sagittal plane. Walking happens in the sagittal plane. Knee extension machine happens in the sagittal plane, so on and so forth with that. Now, when we look at the frontal plane, this is dividing the body into anterior, posterior. Remember, front and back, front and back. The frontal plane does abduction, adduction. Abduct meaning abduct, take away from the body. Adduction, adding to the body. All right, so something like a jumping jack or moving to a side to side lunge or just moving your body laterally back and forth would be like a frontal plane, okay? And your transverse plane divides the body into superior, inferior, okay? These are the movements in here are rotation. This is all rotation movements. So if you rotate your body at your spine, you swing a baseball, right? You rotate, press a weight. These are considered transverse movements here of that. Very important to understand here is not only how it cuts the body into, right and left, front, back, superior, inferior, but also the movements associated. Remember, frontal, flexion, extension. Sorry, let me go back. Remember, sagittal, frontal extension, frontal, abduction, adduction, and then transverse rotation. Sagittal, flexion, extension, frontal, abduction, adduction, transverse rotation is a part of that there. Okay? So that concludes our time talking about an introduction to anatomy and understanding the levels of the body, understanding terminology, all this. Make sure you're reviewing this information because it's going to be really important for you to know this. But this is your introduction to A&P, and I look forward to connecting with you next time as we can talk a little bit more about the different systems of the body. All right, everyone, have an awesome day.